Hello again. This is Dr. David Russ, chiropractor in Portland, Oregon. This is my second video on the topic of herniated discs. If you haven't already watched the video about disc pain and why it hurts, I suggest that you watch that first. And I think it will give you some good background information as to some of the things we're talking about in this video, where I just want to talk about getting out of pain. And of course, that is number one, the most important thing, because if you're watching this, you probably are in a lot of pain. You might be laying in bed wondering if you're ever going to be normal again. And the answer is yes, you are. So in a nutshell, the three layers of pain that are present with acute discs are nerve pain, disc pain, and muscle pain. And these three things interact very closely and kind of reinforce each other, and we need to break the cycle. And so when we look at the stages of healing a disc injury, there are three stages. The acute stage, where it's usually fairly recently after the initial injury, although the acute stage can last for months and months. Hopefully that's not where you are, but sometimes that does happen. That did happen to me. I injured my disc in February, and I was acute until the end of May, early June. This is back in 2008. Anyway, lots of pain, feeling immobile, weakness in the back or neck, weakness in the leg or arm, the nerve pain present, and what we call paresthesia or numbness and tingling. And what we want to do is get you into the repair stage where the pain is less, it's still present, but it's not as intense. The numbness and tingling are going down. You start to feel like you have some strength, some mobility. It's easier for you to get comfortable, and you can tolerate more activity. And this is what we're going to focus on in this video here today. The next stage, of course, is the rehabilitation stage, where the pain is mostly transitioned to soreness and stiffness. The nerve pain and numbness are probably still a little bit present. Sometimes it never entirely goes away, especially the numbness and tingling. For example, that disc that I was telling you about in my body, this is 2021. That was 12 years ago. And if I think about it, I can still feel some tingling in my left foot. No big deal. Doesn't bother me at all. So I want you to notice a couple things here. Number one, these arrows between the stages are in both directions. This is not necessarily a one-way street. People go from the acute to the repair stage and then back again many times, sometimes because they re-injure themselves. I also want you to notice this wavy line indicating that the transition from one stage to the next is not immediate or sudden or black and white. You know, it happens gradually and a little bit at a time. And one of the keys to getting from the acute stage to the repair stage is understanding about granulation tissue. So granulation tissue is what needs to form over the injury in order for it to heal. And let's think about what granulation tissue is. It's like a scab inside of your body. Okay, like if you scrape off some of your skin, the first thing that forms over the skin is the scab. The scab is not skin. The scab is not a scar. The scab is not permanent. The scab is there to protect the injury and to provide a scaffolding for the actual cells and fluid that come in to actually repair the tissue and give you new skin. Granulation tissue is like, it's a mesh. It's not strong. We can look at it under a microscope. Here on the left is what dense connective tissue looks like. Thick fibers all running in the same direction with cross bridges in between them to link them together and give them strength. Granulation tissue under a microscope, see all this white? That's basically space. All the dark purple are either fibers or cells, and they're in there loosely. They're in there loosely. All the red here, these are blood vessels. So this granulation tissue takes time to grow over the injured disc area. It's going to stabilize it a little bit, but really what it's going to do is bring blood and cells and the tissues and nutrients in there that are needed to create new dense connective tissue, which is what you want. That's what it looks like when it's healed. This you can stretch. This, if you stretch or move, it's going to tear, it's going to break, and then you're right back into the acute stage. Now, the best analogy I can give you for granulation tissue is, let's say a part of your building fell down and you needed to repair the wall. So the building, the building wall that fell down, that's your injured disc. You'd put some scaffolding up over the area that had fallen down. The scaffolding is a place for the workers to stand to clear away the debris and put in new mortar and new brick and new wiring and new windows and fix the structure. The scaffolding is good, but the scaffolding is not a wall, right? Wind comes through, rain comes through, people can see through, people can climb through. It's not a wall. If you want to get from acute to repair, you have to let the scaffolding be up and just be scaffolding long enough to at least get some initial repair on the wall. Every time you stretch, it's like a big wind is coming and knocking down the scaffolding, exposing your broken down wall and causing you more pain. So if you take nothing else from this video, please understand that when you are in the acute stage and you want to get to the repair stage, you have to rest. You can't stretch it. Every time you stretch it, you're knocking down your scaffolding. This loose granulation tissue cannot withstand a stretch. I know you're tight. I know you're stiff. I know you feel like you just are craving a stretch. Believe me, I understand, but you're just going to have to wait. You will be able to stretch, I promise. Now let's talk a little bit about the timeline. How long does it take to get better? The short answer is about 100 days to heal a disc, one disc. If you have two herniated discs at the same time, it's going to take longer, maybe 130 days. Okay. Now imagine the end of the acute stage is here, your pain level is very high, and here in the repair stage, the pain starts to go down, but it doesn't just go straight down. It goes up and down while it goes down. And then sometimes it hurts more and sometimes it hurts less. Sometimes, you get a day or a couple of days that remind you what you felt like a couple of weeks ago. That's normal, okay? If you go back and watch the other video on why it hurts so much, one of the big answers is the swelling. And the swelling creates a lot of pressure and brings chemicals that irritate the nerves and creates a lot of pain. That swelling is cyclical. It's normal for that swelling to be high, and then it slowly subsides as things heal, and then it swells again a little bit, and then it goes down, and then it swells, and then it goes down. So this is assuming that you're not re-injuring yourself. This is the normal type of healing curve. Like I said, about 3 months or 100 days, starting the clock from when your acute pain has subsided. And sometimes people are stuck in this loop for months and months and months, okay? Once you're in the repair stage, this is your 100 days, guys. Okay, this is your 100 days. This can be as long as it takes, as long as you keep re-injuring yourself. Once you hit about that 3-month, 100-day mark, normally, often, I shouldn't say normally, I like to say typically, people are more firmly in this rehabilitation stage. Again, it's not a switch that flips. It happens slowly and gradually. One day you realize you haven't had much pain. You took a longer walk than normal yesterday. You expected to be sore and you're not. You don't have that leg pain or arm pain and it feels good. So you're in the rehabilitation stage at that point. Now, what do we do about the pain in the meantime? We can look at over-the-counter medications. And I know a lot of people don't like to take these. I know I don't normally take them. If you're in acute pain with a disc, you may need to take some things you're not normally used to taking. Okay, we got to get the swelling down and we got to get the pain down. And these are some over-the-counter options for you. Some of you may have allergies to certain things. Some of you may know that aspirin upsets your stomach. I can't possibly give you advice about that. Follow the labeled recommendations. The best advice I can give you is that you want to get ahead of the pain. Don't use the anti-inflammatory and painkiller just to respond to the pain. Take it regularly. 3-4 times a day, try and get ahead of the pain. You do that for a couple of weeks, maybe 3 weeks, maybe on the outside a month. It's better to do that than to take it a little bit here, a little bit there for 6 months or a year. You can get ahead of the pain, get the pain down, the swelling goes down, the spasms go down, and you start to accumulate more function, you start to string some good days together, and you're in a much, much better place. Well, what if the over-the-counter stuff isn't enough? And very often with discs, it's not enough because the pain can be so severe. Well, I suggest you call a primary care provider or go to an emergency room, go to an immediate care or urgent care clinic. You should know opioids and opiates and narcotics are dangerous and they are addictive, and they are tightly regulated, and they do not mix well with alcohol, and they can have serious interactions with other drugs. So I don't say this lightly, but sometimes this is necessary for a short period of time. Again, I don't prescribe, it's not in my license. These are just the names of some of the things that people receive. Now, I also want to tell you when you do need surgery. And there's surgery that can come during the repair stage if you really get stalled, or if your pain is just severe and is not changing. We can talk about that in another video, but right now there's a surgical emergencies, and there are surgical emergencies for cervical discs, where the disc is so big that it's actually blocking the flow of cerebral spinal fluid, which backs up into the brain and can create serious, serious problems. Blinding headaches and projectile vomiting are usually two signs of that. In the lower body, in the lumbar spine, if the disc is large enough and severe enough to really compress the nerves to the groin and the genitals and the lower digestive tract, you will get numbness in what we call the saddle pattern. Think about where your body would touch a saddle if you were sitting on a saddle. If that area is numb, that is more serious. In addition, if you're having incontinence, that is a very serious issue, and you should probably be in front of a neurologist or a neurosurgeon within a day. So moving on to some nutritional protocols, I recommend fish oils for their omega-3 fatty acids. These are necessary for the body's inflammatory control. When there is a lot of inflammation happening in the body, those resources can be tapped out, and I recommend keeping it replete. I have this screenshot here from a very popular fish oil supplement, and I just wanted to show you down here that 1,000 milligrams of fish oil only gives 500 milligrams of omega-3. So if you need 3 grams of omega-3, you may need to take 6 grams of fish oil. I just want you to be aware of that. Other helpful things nutritionally are proteolytic enzymes. These are substances that break down the tissue fragments that are floating around in the injured area and are causing more inflammation. These have been studied. They are very safe. They are as effective as NSAIDs, and I recommend using NSAIDs or over-the-counter along with proteolytic enzymes because they work in different mechanisms. So we'll try and get this pain from all sides. I also recommend during the acute stage tissue healing factors. Now, I don't get any promotional consideration from Standard Process for this, but I do recommend this product, Standard Process Ligaplex 1, for acute pain and swelling due to soft tissue injury. You should know it does contain animal products. In addition, I'm a big proponent of bone broth during the acute and repair stage. Everything that's in bone broth is just so nourishing to the soft tissues, especially the discs and the ligaments around the disc. And this is as good a time as any to look at your diet and clean it up. Things that are taxing on your metabolism, things that are hard for you to digest, anything that you know you're intolerant of or allergic to, this is a really good time to cut that out and take that stress off of your body. Let's talk about antispasmodics. As we know, muscle pain is a big part of this. It's one of those 3 layers. And a lot of times if you can just get in there and interrupt that spasm cycle, you can relieve a lot of pain. And the go-to pharmacologically is cyclobenzaprine, known as Flexeril. You should know that it does cause drowsiness and constipation, and it is not as habit-forming as opioids, but it can cause some dependency. As far as nutrients, I recommend magnesium in the citrate or malate form, 500 milligrams a day at least. You should know that Doan's pills, the famous pills for back pain, are aspirin and magnesium. That's all it is. There's some herbal formulas out there and herbal supplements that do help with muscle spasm. Again, I have no promotional consideration here, but the product from Gaia Herbs called Calm ASAP is I found to be really effective. But the most important thing for you is rest. And I talk about things to take, and I talk about pharmacological and bone broth, but you got to lay down. You just have to. And I know a lot of you are probably not used to that. This may be the first serious injury or only serious injury you ever have. I hope it is. But this is different. This is not like when you sprained your shoulder. This is not like when you twisted your ankle. This is a much deeper and more serious injury because of the proximity of the disc to the nerve. It creates more pain, and it has the potential to create more ongoing impairment. So you got to find the most comfortable positions for you and spend time in those positions. You have to avoid activities that hurt you, even just a little. And if you're feeling tired and sore and achy and you're starting to spasm, lay down, rest. You just have to. Prioritize your sleep. For how long? Well, it could be as long as a month. But typically, if all goes well, a week and a half of intense rest is huge, huge to get you ahead of that acute pain, as long as you're also doing those other things that I recommended. And I recommend that you do whatever you need to do to get you out of that acute pain, because it's not just going to go away. It isn't. You got to get some granulation tissue in there. You got to get some stability to get here, and you got to get here to get here. There is no way to get from here to here without going through granulation tissue, tissue repair, the formation of good, strong fibrotic scar tissue, and then you can re-strengthen. So my website is in the description. You can go to my website where you can get in touch with me. I don't give medical advice in YouTube comments. I think that's inappropriate, but you can have a phone call with me or a Zoom call with me. We can talk about your specific situation and the things you may need to do to get out of pain. I would very much like to help you if I can. Okay, have a good day. I'll see you again soon.